Hello, everyone, and hello, Dr. Artemis Morris. I have known you for years, I think since you were at the university, right? Studying to be a doctor. So I'll say that we've known each other since we were 12. And you look awesome. You're amazing. I've seen you do some other shows and explain and educate everyone. And in this Share the Power series, I would love to hear from you because you are an amazing educator. So, first, tell us about you.
Thank you, Dory. I am so grateful that you asked me. And yes, we met at Bastyr many years ago, and you and Sean were just so inspirational. I loved your authenticity, and you still, in terms of a company, in terms of a friend, Brene Brown talks a lot about authenticity, but one of the things I love about your company, about our connection, is how we're real. And this is a really important thing, especially now. So, and I met you when I was also professionally dancing and studying naturopathic medicine. So, it was a really dynamic time for us to come together, and very grateful that you asked me today. So I basically, what I do is I've been in practice 23 years now, and I help people to achieve optimal health and well-being. And I do that using integrative medicine. So, through my training as a naturopathic physician, I'm also a licensed acupuncturist, and I specialize in nutrition. I taught nutrition for many years for the naturopathic medical school, for the master's in functional nutrition program at UB, also as the co-academic director of the integrative health and healing program at the Graduate Institute. And so, my main thing is I have a clinical background as a naturopathic physician, integrative practitioner, and then I also do a lot of educating. And those two, in many ways, are the same thing. But the main therapies that I use are nutrition, specializing in Mediterranean nutrition, and I have some online programs, acupuncture, nutritional supplements, which we can chat about even more later, and really craniosacral therapy, flower essences, herbal medicine, all of the things that were a part of medicine, just medicine, basically before about 200 years ago, when things changed. And this is also my cultural inheritance. So growing up Greek, I had chamomile tea from my mom from Greece. We even did cupping when we were sick. And herbal medicine, food has always been a part of medicine through ancient times. So I feel like my role as a physician helping people to achieve optimal health and wellness really reflects a wonderful amalgamation of modern medicine and ancient healing wisdom.
I love that. And you are incredible with the research that you have been doing. And hopefully, you'll be telling us a little bit more about that later. So, what kind of conditions, things that people are coming to you with, they're suffering, and what comes to your clinic?
I have a general practice, so it's a general, primary care medicine. So for many of my patients, I am their primary doc, but in Connecticut, what I do is actually work collaboratively. And this is where, I love the title of your series, Sharing Power. It's something that is very tricky at times, because, I feel the best way to do that is for us to each know what we're really good at so we can share and find that win-win. And that's what I do in my integrative medical practice. So I will refer to specialists. I will co-manage with other medical doctors, osteopaths, counselors, energy healers, and create a patient-centered approach to healing. So I do, besides primary care medicine, and I do it a little differently though, because I'm a naturopathic doctor, primary care medicine includes nutrition. So as you're well aware, and this is why I became a naturopathic doctor, and naturopathic medical schools are the only general practice trained medical schools that include nutrition nutrition, herbal medicine, and a holistic approach to healing during the 4 years of medical education. And that's why I went that route rather than, conventional, and then later on learn more about integrative or functional medicine. But really, I see general practice, autoimmune disorders, I see a lot. And in the book I wrote with Molly Rossiter on the anti-inflammatory diet for Dummies series, I use some patient case studies in there anonymously to talk about how we can really reverse autoimmune conditions once we treat the cause. So I use the principles of naturopathic medicine treating the cause. I also do a lot with women's health care, with she care, as I call it. In women's health care, we have everything from menstrual disorders, polycystic ovarian syndrome, which is on the rise, PCOS, fertility, menopause, and but it's all focused on empowering and working with the patient using all of the tools that I have at my disposal. Chronic disease is another big part of my practice, reducing, reversing, and preventing chronic diseases. And really, like, the focus a lot is on prevention, but I also do complementary work with the oncologist in Connecticut. So really, I see pretty much every condition as a general practice, but chronic disease, autoimmune, women's health, those are some of my favorites to work with. And anyone who's motivated to change is always welcome.
Wow, that's amazing. And I love it that you work with women. I was having dinner with a friend last night, and she told me a little bit about her history. That was about 10 years ago, where she had some pain in her abdominal area, and the doctor was like dismissive and, oh, you're so pretty and wonderful and young, you'll be doing fine. And then she had to go to the emergency room a month later to get right into an operation. She was bleeding internally. And so women definitely need to be empowered. I'm so happy that you are working with us, and of course we love you, men, too, obviously. And so from BioImmersion, that was a smooth transition, wasn't it? From BioImmersion products, what do you love the most, that you find yourself using the most? And tell us how you use it, because our products are quite layered. They could be complex. I don't like calling them complex, but there are so many uses to each of the product. There's so much research on every ingredient. And so you look at it from this perspective, from that perspective, you use it differently in different situations. They're so powerful, and they keep on giving, which is what I love about that. I think Sean was so ahead of his time when we went ahead with our scientists to actually create these products. What do you love most about the products, and how do you use it?
I love that question. And as you know, I've had the pleasure of doing some lectures on some of the products for specific conditions that I work with. And, how about, like, instead of complex, I think they're very comprehensive, because they are truly an extension of food as medicine. And I feel like, BioImmersion is a cut above the rest in terms of using food medicine products. And so the garlic, and I recently, the other thing I see is in Connecticut, tick-borne illnesses. And I recently personally got anaplasmosis, which is a not well-known tick-borne illness that can be debilitating. It can really turn someone's life around. It can lead to chronic joint pain that becomes irreversible. And I was not treated properly by the conventional model. So I had to really rely on my integrative team to get the proper diagnosis and treatment. But the garlic is such a powerful antibacterial. Even here in Connecticut, one way I like to use it is if I'm going to go outside being exposed to ticks, like, I will recommend people just take garlic prophylactically. Garlic is so wonderful for yeast syndrome. So in terms of women's health, treating bacterial vaginosis, treating candida, treating any kind of condition that is a dysbiosis. And I have one of the areas that I loved lecturing about, and I'm a little obsessive about, I have to say, is the microbiome. And I know we have lectured on this subject. I wrote an article on the vaginal microbiome in NDAR. And it's, anything that involves an imbalance of the microbiome, I feel like so many of your products are very useful. So the garlic, one of my favorite products that I like to use is the Cranberry Pomegranate because it has the D-mannose in there. And so for chronic UTIs, for keeping the microbiome healthy for women's health. And that is so important, especially because another area that I'm very passionate about is how in the world, we have the highest maternal toll for women and babies. So we're not doing well in that arena. And especially for minority women, I'm very passionate about, helping to even out the playing field and some of these products can be very instrumental with that. And I'm hoping to be able to talk to some of my sisters in, working on that, but the cranberry pomegranate would be great. Garlic's great for that. The probiotics are so wonderful. And one thing I love about it is I know you, Dory. I knew Sean, God bless his soul. He's still with us. And, these probiotics, these are like our friends, right? Probiotics are not just like, let's throw a label on it and make some money. That's never what I've ever felt from your company. Your integrity is higher than any other company. And even my patients notice how they feel on these products different from other companies in terms of purity, in terms of other ingredients. And one thing that I love to tell people, so like I've got a few supplements here. I'm out of my cranberry pomegranate, which I need to reorder, but like Supernatant is great with that locked orn. I mean, wow. I have chickens. I'm like, I should give them some of that Supernatant to keep them calm as well. But some of these products, especially the probiotics, I feel are a cut above the rest and my patients notice it. So any kind of dysbiosis, post-antibiotic, some of the number 7, the Beta Glucan is also one of my favorite products. And I use that a lot, diverticulitis. And I think I might have even written an article about that. But basically like with the Beta Glucan, I feel like it's a revolutionary product because it makes it so that patients can just take one thing. And this is why I feel like it's comprehensive because some, patients get overwhelmed with too many supplements.
Yes.
And hardest things for me to do as a integrative physician specializing in nutritional supplements and expert opinion in it is take all their information, all their labs, everything that's happened to them, from a functional medicine standpoint, and then come up with a very elegant plan that's not going to overwhelm them in stages many times. And one thing I love about BioImmersion products is I could recommend something like a beta glucan for someone with chronic GI issues, for diverticulosis, diverticulitis, and it's going to work because it's a combination of beta glucan, which has immune function, and it has the probiotics in it, so that we're working on getting that immune system healthier. It's also lowers cholesterol, so they might have hyperlipidemia. So it's working on all these levels, like I said, as a food medicine. So it's I like your products because they're comprehensive. They're good places to start. And then they also are very effective. So really appreciate that about your products, your integrity, and God bless Sean for, being one of the pioneers with you on this food medicine.
Thank you so much. Wow, Artemis, I like that, comprehensive instead of complex. Of course, I love complex things, but it does sound a bit overwhelming, which brings me to our last question. And that's one of my favorite because I get to know you better and everyone is going to get to know you better. I ask typically, what is your hope and inspiration for the future? And the reason I do it, because we are more than what we just do. Yes, we are in the medical industry. We do our different roles, but we also have passions. Mine, of course, is in international relations. Everybody have heard me blab about that forever. And it's exciting for me now even more because initiating a research project is always exciting. It's like getting pregnant and starting to develop this child inside of you, and giving birth to it is unbelievable. Taking care of it, it takes a lot to do a research project and to actually test the theory that I built. It gets me out of bed. It makes my life more joyful, happier. And I feel about the future a lot more hopeful when I have that intent to find out what would get us back together here in this reality, what's going to unite us, make us into one. And so what gets you going? What does rev up your engine, your passion, and your love in life?
Thank you for that question, Dory. And I love the analogy of giving birth because, with research and it is such a, what we're all experiencing all the time, even though it feels like it's new. It's like, this is the, there's the healing crisis. This is like the alchemy of healing. There's so many ancient wisdom has really best understood these cycles that we all go through. And this is why I love being able to use these ancient tools. I'm really grateful for the people, for the cultures that retain their traditional knowledge, in acupuncture, in herbal medicine. And so much of that knowledge has been lost, in terms of, how women with herbal medicine knowledge were treated throughout history, how women in general were treated, how people, even people who thought the world was, actually not flat. There's so many researchers, scientists, people of knowledge that we can call upon. Avicenna, there's, Theophrastus, Hippocrates, like there's so much knowledge that we all have at our fingertips. But I really am so honored. And, I feel like it's my passion and purpose to bring together, our modern medicine techniques. We do a checkup, but I have at my fingertips this, acupuncture, herbal medicine, and also looking at really this alchemical process of healing that I have the honor of being witness to and being able to sit with. So one of the things that really helps me in this passion for transformation, really, it's for self-actualization. And then the research part is another thing too. I'll tell you a little bit about what I'm up to with that. But this passion for making it sounds corny. I feel like I'm, but making world peace, making the world a better place, but these are actually truly things that I feel as a naturopathic physician, as a holistic practitioner, I feel like I am contributing to that with every patient I connect with, because it's not just about taking a pill and lowering your cholesterol. If everyone who had high cholesterol, high blood pressure, autoimmune disorder, some type of orthopedic issue, not only went to a doctor that could lower the blood pressure and then send them back to a high stress environment, send them back to chronic low level GI issues, send them back to fatigue, a bad relationship. Instead, they go to a holistic practitioner who's interested in looking at how that high blood pressure, how it came to be, what's the cause of it. And as we know from Eastern medicine, from Ayurveda, these are systems from even looking at Greek medicine, Galen, like even the origins of the medicine that we have as modern medicine today, it was always holistic up until a couple hundred years ago, because we are not two-dimensional beings. Like we might like to think that, oh, if I just lower my blood pressure, that's all I need, I can keep going. But that is absolutely not true, because you and I and anyone listening to this right now can think of, oh, I was stressed out. Why did my blood pressure go up? Why did I get clumsy and have this injury? Why do I have this autoimmune disorder that has incapacitated me? We all know that there are psychosocial factors that contribute to that. And we all know, and what we might not know, and this is where a practitioner like myself helps and your products help, is we might not know how to begin to change that. But it's really about self-actualization. It's about making, helping us to reach our potential. You can see I get jazzed about helping other people reach their potential in a way that is truly holistic. I go to the depths with them where there's that abusive situation or wherever we need to go, and whatever resources they need to find, or I can help them find to reach that level. But, for me personally, like the research is very exciting as well. And I'm hoping we can collaborate more on that. So I originally in ethnography and Mediterranean diet. And so, clinical study on that. And right now I'm working with Yale to do a study. It's a pilot study on high oleocanthal, so a high antioxidant olive oil, and its effects on lowering inflammatory cardiovascular markers. And so this is another example. So for me, the research that really thrills me is research on herbal medicine, research on food as medicine. And one thing I would like, for everyone to keep in mind mind, because I hear this a lot. Oh, it's not well researched. There's not enough research. I would really like to see a scientific model that acknowledges and incorporates, and Deepak Chopra mentioned this at one of the scientific conferences we were at together, is, how research needs to include a model that includes traditional medicine, the thousands and thousands of years of traditional use of how my mom used chamomile tea for children that she learned from her grandmother. And yeah, we need to do some in vitro studies. We need to do some clinical studies, but I get jazzed about research too. And we should definitely talk. Please let me talk more with you about it, because you are the goddess of research. And so I would love to see that, the acknowledgement that yes, the thousands of years of women, of people who have used herbs and supplements and garlic and wild blueberries and have collected it in a traditional manner, have prepared it using traditional techniques that have been in conjunction with the environment. And that's the other issue I know you're also passionate about, and Sean is preserving and sustaining a natural environment so that we can use food as medicine. And because another piece that I get really, I've found in my practice that's really important is detoxification. And so the conditions I see, especially women's health, especially endocrine disruptors, like these are the forever toxins in our environment. We're exposed to thousands of them every day. Cancer, like any condition, diabetes even is influenced by fat soluble toxins and endocrine disruptors. So I guess what I'd like to see is more research, maybe, or more acknowledgement. I'd love to see more emphasis on self-actualization in a way that we can be a more cooperative, sustainable society. And for me personally, I also love to travel and lecture, and I'm doing a lecture in Greece. Everyone is welcome to come, but it's in April, talking about food and medicine. So I love lecturing on the subject, and seeing patients transform, and doing this, having conversations with wonderful people like you, Dory, who want to really bring this knowledge out, that they don't have to be afraid or, kind of cognitively think, oh, I should just do what this doctor tells me to do. You can't think for yourself of like, how do I feel? So we can create more self-actualized individuals, and we can all inspire each other to be well.
Yes, that's the transformation and I love the word transformation, of course, that you're talking about. And we are going to schedule another one of our sessions about research, because yes, they are actually other world theories that are research oriented, that give you a totally different perspective on how to research whatever area that we want to research. And it does include all the different pieces that come from our past. And so we will talk about that. We will talk more about your research and that tour of yours in Greece. Oh my God. With all the good food, the sunshine, and April is a beautiful time. Oh my God. So we'll have to do another session soon and bring that up again, because, oh, so tempting. Artemis, thank you, thank you, thank you. Everybody is thanking you. You are incredible. Your work is incredible. I love to think about holism in medicine, holism in politics, holism in education, and sharing knowledge and love is definitely sharing our power. And so thank you for sharing yourself with us today. And I look forward to our continuing time together.
Thank you, Dory. And thank you, Sean, always with us.
Always.